Everyone. Today I am going to teach you about the examination of victim of sexual offense. This is a very important topic of FMT, uh, which is asked in a practical exam. Okay, in this we are going to examine the victim. Okay, so first we have to keep in things in the mind. The first is the prerequisite conditions. द इन दिस हम क्या करते हैं, सबसे पहले अथॉरिटी का कंसेंट लेना ज़रूरी है, जिसमें आपको इन्वेस्टिंग ऑफिसर हो सकते हैं या कोर्ट हो सकता है। और फिर आइडेंटिफिकेशन करना पड़ता है। आइडेंटिफिकेशन के लिए या तो कोई ऑथराइज्ड होना चाहिए, जैसे पुलिस कांस्टेबल है, वो विक्टिम को आइडेंटिफाई करता है या वो लेके आता है। और एग्ज़ामिनेशन करते हैं उससे पहले हमें विक्टिम का कंसेंट ज़रूरी है। अगर फीमेल अगर विक्टिम जो है वो 18 साल से अगर कम है, लेस देन 18 ईयर है, तो हमें उसके गार्जियन की इन्फॉर्म कंसेंट ज़रूरी होता है। और एग्ज़ामिनेशन के लिए एक फ़ीमेल अटेंडेंट ज़रूरी होती है, अगर कोई मेल डॉक्टर प्रेजेंट है तो। हियर इज़ द examination, that is the first to ask after the prerequisite, the preliminary data. The following details are keep in the things. First you have to ask the name, age, sex, address, occupation, or whom brought by, that is a police constable, name and number of the police constable, accompanied by the female attender, or where the examination is taken place, the date, time, place or examination, and written consent inform. Just as I above says, if less than 18 years, then parents are give their consent. So this is the format to you have to write in your exams, like the general particulars, MLC number, it may be something मन से लिख सकते हो, प्लेस, डेट एंड टाइम, कहाँ पे हो रहा है, हॉस्पिटल नेम, ब्राउड बाय पुलिस, रेफर बाय पुलिस, नेम ऑफ विक्टिम, डॉटर ऑफ या वाइफ, सेक्स फीमेल, एज स्टेटेड, सेक्सुअल ऑफेंस, एड्रेस, फीमेल अटेंडेंस प्रेजेंट और नॉट, नेम, signature, inform, express consent, yours oneself or maybe by the parents, signature of left thumb impression by the victim, or and the identification marks like scratch marks, mole, present or not, bleeding, etc. अब हम इसके एग्ज़ामिनेशन कैसे करते हैं। एग्ज़ामिनेशन में बहुत सारे पॉइंट्स हैं। तो फर्स्ट हम देखते हैं जनरल मेडिकल हिस्ट्रीज। उसमें पूछ ली जाएगी पहले कि क्या है उसके पास हिस्ट्री, फॉर एग्जांपल ब्लीडिंग डिसऑर्डर है या मेडिकेशन है या कोई एलर्जी तो नहीं है, डिटेल्स ऑफ एनी मेडिकेशन, और अल्कोहलिक इंटेक ड्यूरिंग लास्ट 24 आवर्स, या उसको फोर्सफुली कोई अल्कोहल दिया गया है, ये सब हमें पूछना है पड़ेगा मेडिकल हिस्ट्री में। देन मैरिटल एंड ऑब्स्टेट्रिक हिस्ट्री, मैरिड है या अनमैरिड है फर्स्ट। देन ऑब्स्टेट्रिक हिस्ट्री, एज ऑफ मिनार्टी, कब उसको शुरू इनमें फर्स्ट मेंस्ट्रुएशन हुआ, मेंस्ट्रुएशन की फ्रिक्वेंसी, रेगुलेटिंग ऑफ मेंस्ट्रुएशन, डेट ऑफ लास्ट मेंस्ट्रुएशन कब था, हिस्ट्री ऑफ प्रीवियस सेक्सुअल एक्सपोजर, हिस्ट्री ऑफ स्टरलाइजेशन एंड यूज ऑफ कॉन्ट्रासेप्टिव्स, हिस्ट्री ऑफ एनी STD, वेदर ट्रीटेड और नॉट। नाउ दिस इज अनदर टॉपिक, अनदर हिस्ट्री ऑफ एलिज्ड क्राइम, स्पेसिफिक टाइम जिस पे क्राइम हुआ है, तो हमें उसका डेट पूछना है, टाइम, प्लेस ऑफ द एलिज्ड सेक्सुअल असॉल्ट, स्पेसिफिक नेचर ऑफ द असॉल्ट, द क्लोथ्स इज रिमूव बाय whom or how, whether the penetration has taken place or not, if yes, whether penetration was vaginal or oral, anal, any instrumentation or object were inserted, any body fluids were left on the victim's ejaculation, saliva, urination or defecation after the intercourse, post incident, whether the victim has washed the genitals or taken bath or change of clothing. And another terms that is and the number of assailants involved. These are these are the general question you have to be uh, keeping things that is are emotional, tense, and depressed already the victim. So you have to be very supportive, encouragement to ask that following questions. Here is the format of the history you have taken as per the police report where she is found, account given by the victims, the specific alleged crime, date, time, place of offense, date and time of last intercourse, contraceptive use or not, position at the time of offense, menstruating at the time of offense, examination, insensible or insensible due to intoxicant trauma, attempt to resist the offense, mit- mitigated, not mitigated, was the part taken or not, clothes change or not change, give something to eat or drink before sexual act, after sexual act, bleeding discharge, felt sensation of penetrations, etc. These are the 13 important points you have to be asked in the history of alleged crime. Now we are in the examination part of our fingernails, like the fingers are ragged or broken nails, blood skin tags or any foreign bodies are under the nails, कोई blood stain tag तो नहीं है. ये fingernail scraping of all the fingernail are collected in a separate bags of plastic and label them and sent to a forensic science laboratory for examination. Torn up if the torn up epithelial cells are present, if detected, then would belong to the accused maybe and may help to improve the crime by doing a DNA analysis on the detected cells. This is a very important marking. अगर किसी का हमें epithelial cells वहाँ पे मिल जाती हैं तो ये एक बहुत अच्छा वो DNA एनालिसिस हो सकता है, तो हमें इजीली एक्यूज फाइंड आउट हो सकता है. सॉरी, वो फिंगर नेल्स एग्जामिनेशन पहले हो गया. द फिंगर नेल एग्जामिनेशन इज ऑल्सो अंडर द जनरल एग्जामिनेशन. सो आई हैव द फर्स्ट जनरल एग्जामिनेशन in height, weight, and general build of the victim, abdominal girth at the level of umbilicus, and the chest circumference at the level of nipples. Examination of BP, pulse, heart rate, respiratory rate, examination of teeth, eruption, and injuries are present or not, presence or absence of a secondary sexual characteristics. Examination of clothing. The victim is made to stand on a clear white sheet of a paper and asked to undress herself, collect any material that fell onto the paper of the victim. If it is not washed or genital taken bath or change her clothing. Examination the clothes for tears, any stain, blood, smear or any foreign bodies adherent to the clothing, sand, mud, etc. If stain present on the clothes, it has to be dried or preserved, packed and labeled and sent to the forensic laboratory for the examination. Examination of the body surfaces. The whole body surface must be examined for injuries, old and new. Document everything with case as to the nature of the injury, the size, shape, location with reference to prominent anatomical landmarks where necessary. Specific attention for recent injuries, that is a scratch and bite marks. Examination of skin. Examination of skin. Any soiled area on the body must be swabbed, preserved, and sent for analysis to the forensic science laboratory. Use UV lamp. Bill level are of a fluorescent seminal soiling, scratch for loose foreign hair or any other foreign material on the skin. This is already I cover in the previous. And we are here the local examination. So in the local examination, external genital examination, the first examination of the pubic hair are matted or not. If matted, the bunch of material matted hair cut and preserved separately, and that is for comparison purposes with the loose hair. Look for injuries like bruises, bite marks, nail scratches, etc. Come to the inner aspect of the thigh labia and should be properly documented everything. Now doing the internal examination using a vaginal speculum. Vaginal swab are taken. Examine the lining of vagina. Note for any bruise, abrasion or tears. In digital examination, two finger test which will reveal areas of pain, tenderness in vagina, laxity of vaginal orifice, indicate previous penetrations, build elongation of posterior fornix indicating habitual sexual intercourse, size of the vagina, that is a 1 2 3 finger test, but this is a controversial, so that I marked across. Vaginal washing, the spermatozoa and prostatic secretion are present, so vaginal washing is done, which indicate the acidic phosphatate taste collect separately. Here the examination of a hymen. In rupture of hymen occur with the first sexual intercourse. So it is torn 4 or 8 8 o'clock or in the middle, tearing mostly. Soon after, margin of hymen are sharp, red, which bleed on a touch. After 3 to 4 days, the edges are congested and swollen, which heal completely in 1 week. Rupture of hymen due to sudden subjecting can be caused by agents other than penis, such as a finger. Therefore, evidence of local injury is not a proof of penetration. Like abrasion, bruise, hymen, vaginal canal, and the vaginal orifice. Mm, Here is the certification of rape. Rape is a legal term and not a medical diagnosis, so we should be restrict ourselves within the boundaries of a science to certify the rape. Never use the word rape in the certificates. Any evidence suggestive of recent sexual intercourse that may be a dubious struggle or mutual consent, or it may be evidence of a forceful consent. So these are the conditions you should be keep in their mind to make the certificate of rape. Opinion. There are evidence suggestive of recent sexual intercourse or not. No sign of recent sexual intercourse. These are the points you have to be keep in mind to make the opinions. If present, it could be the forceful. If struggle present within a severe injuries in and around the genitals. Proper documenting of all the injuries present on the body would automatically indicate the victim offered resistance. It is for the court to decide whether such sexual intercourse was a rape or not. Since the female who has uh, declined children and if a forceful vaginal penetration may not leave any sign, and we would be forced to find as there are no evidence suggestive of recent sexual intercourse, especially when a recent laboratory reports are negative. So if to make the reports, you have to written like this, that the local examinations like inner aspect of thigh, matting of pubic hair, present node, blood, seminal stain, vulva, hymen, foresheet, posterior commissure, perineum, navicular fossa, cervix, evidence of venereal diseases, discharge, any other. The sample collected for laboratory examinations like clothes, that for stain or tear examination, any loose foreign hair, fiber, scalp hair, nail scraping, saliva, for grouping as secretary status, any other comparisons, blood in EDTable for chemical analysis, any other drug or alcohol, blood in plain bulb for blood grouping, pubic hair for acidic phosphatase, any other, vaginal smear, swab, urine for alcohol drug grouping, any discharge for evidence of any venereal diseases, any other. Now the opinion, there is a evidence, no evidence of recent vaginal penetration. Vaginal penetration has never taken place. Evidence of recent and consistent with penetration. These are the opinions